You started the medication. Finally, you could sleep through the night. The stream got stronger. You thought the problem was solved. Then you were intimate. You reached the climax. The sensation was there. But nothing came out. Let me ask you something right now. Are you taking Tamsulosin, Flomax, Silodosin, Rapaflo? If yes, I already know what's happening to you. Because this happens to up to 30% of men on these medications, 1 in 3. Your doctor probably never mentioned it. But I'm about to show you exactly why the medication is doing this. And let me guess what else is happening. After it happened, the next time you urinated, it looked cloudy, thicker than normal. That was the fluid. It didn't disappear. It went backward into your bladder. You're not broken. Your body is doing exactly what the medication is telling it to do. The question is whether you want to keep taking it. Here's what's happening inside you right now. At the bottom of your bladder, there's a gate. Doctors call it the bladder neck. Think of it as a door. During climax, your body slams that door shut. Fluid has nowhere to go but forward, out the front. But the medication you're taking, it relaxes muscles. That's its job. Relax the prostate so you can pee. Problem is, it also relaxes that door, paralyzes it open. So when the moment comes, the door won't close. Fluid looks for the easiest path, and the easiest path is backward, into your bladder. Not all medications do this equally. Tamsulosin, also called Flomax. Research shows 8 to 18% of men experience this. Silodosin, brand name Rapaflo, much more targeted, works great for urination, but the rate jumps to almost 30%. If you're on Silodosin and nothing comes out, this is almost certainly why. Write in the comments which medication you're taking, Tamsulosin or Silodosin, for every other man watching who thinks he's the only one. Is this harmful? Physically, no. The fluid mixes with urine. You flush it out. But let's be honest, it's psychologically devastating. It affects your confidence, changes the dynamic with your partner. You start dreading intimacy. And here's where it gets worse. That anxiety triggers adrenaline. Adrenaline constricts blood vessels. Now you're not just dealing with dry orgasm. You start losing the erection itself. The medication caused the dry orgasm. Your anxiety about it caused the ED. One problem created another. Now the question you've been waiting for. If you stop the medication, does the function return? Yes. These drugs have a short half-life. For most men, stop taking them. The door starts closing again. Within days, not weeks, not months, the function returns. So what are your options? Option 1, accept the trade-off. If your symptoms were severe, maybe this is worth it. Option 2, lower dose. Sometimes less medication still helps urination without fully paralyzing the door. Option 3, switch medications. Finasteride works differently, doesn't hold the doctor open. Has other trade-offs I'll cover in another video. Option 4, address the root cause. The reason you needed medication was prostate inflammation. If you reduce that inflammation naturally, you might not need the medication at all. Researchers have identified compounds that target prostate-specific inflammation. When inflammation decreases, the prostate shrinks. Symptoms improve. Some men reduce or eliminate their medication entirely. The link in the description has the research. Read it. Understand the mechanism. Discuss with your doctor. You have more control here than you think. Here's what I need you to understand. You didn't break your body. You're renting a solution. And the cost of that rent is this side effect. Stop paying rent. The function comes back. If this is happening to you, comment. This is my medication. Subscribe. The video comparing Tamsulosin versus finasteride is next. See you in that one.